All right, great. Well, hi, everybody. My name is Rebecca Morgan, and I am the president of the Kentucky Medical Library Association. And it is my great pleasure to welcome you to our first ever virtual conference. I am really excited for you guys to join us today. Setting up this conference has been a somewhat bumpy road, but especially on my part with all my messed up emails, but I am very thrilled with the outcome, and I really think that we have some very interesting discussion and presentations to share with you today. As president of the Kentucky Medical Library Association, it has been a great experience organizing this conference alongside our treasurer, Lauren Robinson, and our secretary, Tiffany Gibson. I couldn't ask for a better executive board to work with. They have always been willing to put in the extra work and have come up with such creative ideas that have not only pushed KMLA into new territory over the past 6 months, but have also made this entire conference possible. For a while, I have felt that KMLA has struggled a little bit with its identity. What is our purpose and what benefits are we offering our members besides interlibrary loan reciprocity for institutions and networking opportunities, for members during our meetings? While a conference is hardly revolutionary or completely unique to what other library organizations are doing, I do hope that it is the start of something new for us, something that will benefit our members in a tangible way while also helping to strengthen us as a community. I hope we can continue to offer virtual conferences that highlight some of the research happening in Kentucky and give a consistent platform for members and friends to share their own unique projects and experiences. So this conference originally started as kind of a whim as Tiffany, Lauren, and I were trying to figure out how we could keep KMLA members active, engaged as their daily lives were so completely upended by the pandemic. Last year, we worked to try and make sure we were covering more of the state by holding meetings in Louisville, Lexington, and Pikeville. And we tried to hold special events linked to our meetings, including a social with library students in Lexington and touring the simulation lab at the University of Pikeville. We had every intention of continuing these events and to try and travel to different locations to host meetings, but obviously a global pandemic kind of stuck a fork in that. And as travel for conferences became increasingly impossible and travel budgets were suspended, a virtual conference just seemed like a logical next step. It would allow members to participate from across the state without really having to travel, and it would allow everybody to participate with no registration fees beyond the cost of KMLA membership. For April, I never really considered KMLA as hosting its own conference. I had talked with some folks in the past about how we needed to provide more services and functions for our members, and while some of that discussion did include us becoming more involved in local and regional conferences like Joint Spring or Greater Midwest, I never really thought we'd do it ourselves, especially on such a tight time schedule. Except now in hindsight, I wondered why we haven't been doing something like this before. If we want medical library scholarship to increase in Kentucky, and if we want to build a stronger sense of community through sharing projects and ideas with our fellow libraries across the state, a formal conference is one of the best ways to do this, especially a conference that is basically free outside of our yearly membership fee. So it only makes sense that KMLA considers offering regular conferences that are easily affordable and readily accessible to our membership. While we might not provide flashy events or prestige of larger national conferences, we can still provide a safe, welcoming environment for those who wish to build up their CVs or give a presentation for the very first time. And more importantly, we can start to learn more about our friends who are working on projects across our state and build a statewide community founded on our shared knowledge and experience. Our presenters today are made up of a wide assortment of health sciences library associates. Our presenters include library students, library staff, and faculty members. A couple of our presenters are giving some of their close to their first conference presentations, while others are veterans from attending and presenting at both regional and national level conferences. This variety in experience and background can only enrich our organization and help us grow in our understanding of what it means to be a health sciences library professional in Kentucky. And that is exactly the outcome I'd hoped for when Lauren, Tiffany, and I first started talking about this conference. We wanted to be more than just a group of the same faculty coming together to share our research projects. We wanted everyone to feel like they could be part of our organization and have a voice in our discussions. So even without a single presentation being given yet, I feel confident that we've accomplished something special with this, something that we can hopefully build on and use as a foundation for what the Kentucky Medical Library Association can accomplish in the future. So Today we have a bunch of very interesting presentations to share with you, in addition to a chance for everybody to participate in a discussion roundtable that will be moderated by the KMLA Executive Board, myself, Lauren, and Tiffany. We're going to start with a long form presentation from Jessica Petrie from the University of Louisville Kornhauser Library. She will be discussing her experience with presenting health sciences information to public librarians. And after her session, we will have our first session of lightning talks, which will last approximately 15 minutes. And then after our lightning talk, we are going to have a 20-minute roundtable where all attendees are encouraged to discuss how the COVID pandemic has impacted their library services. We do have a couple questions prepared to prompt discussion, but we want everybody to feel like they can speak up and join in the conversation, including students. We want to hear about how the pandemic has affected your education or your future job prospects, any of your input that you have on this topic too. And then following our roundtable, we'll have approximately a 10-minute break so everybody can catch their breath and relax for a little bit. We will stop the recording during that time. And then after our break, we will have our second round of lightning talks and then close the conference with Riley Sumner's long form presentation on how the University of Louisville Hospital partnered with the Louisville Free Public Library. So again, welcome and thank you all so much for joining us today. And without further ado, let's get started. So Jess, you can begin whenever you wish. Oh.
Okay. I'm working with my dual monitors today, so I'm making sure I'm just sharing the one that has the interesting stuff on it and not my embarrassing email. That's what's taken me a little bit. Okay, that should have it. Oh, too fast. Okay. Okay, so you can somebody confirm you can see it? I can't see the chat anymore.
Yes, I can see it.
Okay, thank you. I am Jessica Petrie. I'm Associate Director at Kornhauser Health Sciences Library at the University of Louisville, and I'm going to be talking about the outreach I've done through GMR and how I've been presenting health sciences information for the public librarians in Kentucky. So I'll start out with talking about GMR's model of outreach and instruction, what a partner outreach library is, go over the sessions that I've done and the one that I had planned and am not doing yet, the expectations they have for instruction and for outreach in general, reporting on that and how I've adapted it to make it work for me, and then some lessons learned, and then have time for questions. So the partner outreach library for the Greater Midwest region of the National Network of Libraries of Medicine. These are just libraries that conduct outreach on behalf of the GMR office and in conjunction with. So I do a lot of, not a lot, especially anymore, but when I do outreach, it's Kornhauser focused, it's Louisville focused, and by incorporating GMR and National Network of Library Medicine resources, they help with the funding for that. So we're conducting outreach with them, doing educational sessions, or just promoting the resources at tabling or exhibits. The partnership really involves promoting those resources, whether that's by tabling or exhibiting at health fairs and community events, or through the educational sessions, train the trainers, that kind of thing, And then GMR reimburses the partner libraries for staff time, travel, some other expenses, and they supply some handouts, brochures, promotional items, and then a few more fun things like stickers and posters and all that. And then they have some other resources that can help too, like slide banks or handouts and forms that you could use if you are doing instructional outreach. And this partner is established through a signed MOU between the region and the partner library to lay out the expectations that they have for their outreach. The example activities, they're fine with me tabling. They always appreciate tabling at health fairs and community events is appreciated, but they have a real emphasis on instructional sessions. The ones on the screen now are the examples they give for teaching public librarians about using the resources, train the trainer sessions, even teaching community directly. And then that's how this fits in there, is presenting a session at an annual conference for public librarians counts to satisfy that part of our MOU. And we have a whole website for the partner outreach libraries and the tools and the resources they have for us. That includes our reporting system, what we need to put in terms of statistics and evaluations to keep up our part of that agreement, and then some tools and some resources that we can use to complete our part of the agreement. So they have PowerPoint templates and slide banks, all that good stuff is through this website. In that, the only thing is that funding the reimbursement doesn't cover giveaways like swag kind of items, but with the time and the registration and expenses reimbursement offsetting those costs, I can spend all my outreach money on rainbow brains and ink pens or whatever fun stuff I want to do. So the sessions I've done so far, the first year I did a lightning talk on complementary and alternative medicine. And then that was an introduction for myself. That their Ignite talks are comparable to our lightning talks, but they're a lot more stressful at the Kentucky Public Library Association because they are timed, not by, there's not a person telling you when to stop. The slides advance automatically. So you have to have your timing down perfectly and just keep going and hope for the best. So I had to sacrifice some of my time just explaining what it takes me a minute and a half to say Greater Midwest Region of the National Network of Libraries of Medicine and explain what all that is and do that intro. I did some definitions and data explaining what complementary and alternative medicine is. I did some red flags, bad science type stuff that they could watch out for, some critical appraisal, and then a substantial focus on NNLM resources. And then the next year, I did a full session. I had a full hour. Yeah. So I still had to do that intro, went into more data and context for how the opioids were impacting Kentucky. And then I did some on language, a substantial chunk on language and stigma and how the words we use to describe medical conditions matter. I did some definitions of the differences between opiates and opioids and synthetic and man-made and medicine and all those. And then the stuff you would expect. So the NNLM resources that I had to promote to hold up my end of the agreement. And then I got to go into a little more depth with specific populations, and then some education and programming resources that were available. And then this is the one I had planned for this year. I was going to do coronaviruses. And that's actually not my title. KPLA picked that title for me. But it was just going to go into an introduction, of course, and then what COVID-19 was, some history of the disease and other coronaviruses, some science, basic science stuff. And then I really focused in on the statistics on this one, because from the earlier talks, they were very interested in the science and the language side of things more than the resources side of things, which makes sense. They're librarians. They know how to find the information. They need help interpreting it. So I had planned I didn't get past my statistics before it was canceled, but I had also planned to do a little more on evaluating biomedical research and the resources, but the focus in this one was really expanding that language of medicine and statistics and interpretation. And as an example, these are slides directly from that presentation. I framed most of my section with common questions you would hear about coronaviruses. And one of the things that kept coming up was, is it really worse than the flu? All that stuff. So this is my intro to stats, very basic level. And I put this up and I say, which one's worse? And then everybody, I don't know if it would have been very interactive. The hope is that they would think about that and have some ideas. And then we have to talk about how we're defining worse in terms of severity of impact on the patient, of the mortality. So how many people that are affected, how many die, how many are affected long-term outcomes, even if they're not part of that mortality statistic. Is recovery a thing? What are the long-term outcomes? And how likely is it to spread? So these statistics are probably hopelessly out of date by now, but explaining what an R0 value is, so the mathematical average of how many individuals one sick person will infect as compared to other diseases they may have heard of. And then ultimately at the end of the statistics section, I would go back to this picture and pose the question again and say, well, sharks kill on average about one person a year. So they're the scary ones. You don't want to encounter it, but you're probably not going to. Cows tend to kill about 20 people a year, but we put a bunch of them in big pens and then we try to make them do things. So we're more likely to encounter those. That doesn't necessarily mean that they're vicious. It's just a situational correlation. And then the deer kill about 50 people a year through car accidents and things. So those are way up there. Of those three that you're probably looking at, the deer is the most deadly. But this little guy is the most deadly of all, and mosquitoes are killing several million people a year. So those are very basic examples for statistics that kind of help focus on processing the information they may be hearing rather than retrieving it. So the expectations and adaptations I've made, like I said earlier, there's a variety of shared resources. We just have to give them credit. There's also a required disclaimer that you have to include because this is federally funded. You have to give credit to NLM and NIH and all those good organizations and make it very clear that if you say anything ridiculous, that's your own fault and not the views of the National Institutes of Health. But I also usually combine that slide with any kind of acknowledgement I need to give. So GMR had slide banks ready. They were heavily adapted to fit it into a lightning talk, but we did want to give credit to the original creators there. So I usually combine those slides. And then I always put in one like this because I'm very much not a doctor. And I want to make that very clear, especially with the coronavirus one. So with the reporting expectations, most of it's pretty standard. You want to explain what the activity was, where, when, what organizations you've partnered with, any resources that you promoted, and demographics you were targeting. So that's not necessarily taking notes of the different intersectional identities of every person that comes to the table. That's if you're going to Pride, you're going to write down LGBT. So any intentional targeting of demographics for resources, not necessarily an accurate reflection of those coming to the table or attending your session. The zip codes is where it gets weird for me. And this is what the form that they give you to fill out looks like. And it doesn't make any sense to anybody that sees it other than us because we use it. And I don't want to ask for, I think it's weird to ask for zip codes in conjunction with like signing in. So what I do is I have two sign-in sheets when I do these. I do a sign-in sheet, which is like, it's not really required. I'm not going to hop off the stage and make anybody sign in, but that's the one that has the zip code. I ask everybody to fill it in, and then I assume everybody that is at KPLA is a public librarian, but if not, they can tell me. And then I do a separate sheet where they can give me their name and email if they want the slides sent to them after. And the biggest change that I've made has been the distribution of the information. So in 2018, I had 5 minutes of auto-progressing slides, and I was told I was really focused on doing this as an NLM outreach. So I had to promote the NLM resources, which is true, but it was to librarians. I can tell them what they are and they can figure that out. I don't need to explain to them how to use Medline Plus. So I spent too much time on that and not enough time on the definitions and data, which is what they were really interested in. 2019, I spread it out a little more. And because I did have a full hour, I was able to go into the resources for different populations. So different languages, age groups, communities, LGBT, PTSD, chronic illness in relation to opioids, all that good stuff. And some educational resources. So resources specifically for librarians and developing programming. It still had some element of listing out different NLM resources they might want to use, but I was able to go in more depth with that, and I was able to spend a lot more time giving that contextual data about the regional and local, regional, and a little bit national context for opioids. And then this one I didn't finish, but the plan was to go way more in depth, take it all the way in and do mostly, and this is just a breakdown of the slides I made and plan to make. Some of them are blank slides, but really go into coronaviruses and the previous outbreaks of SARS and MERS, spend a good chunk of time on the language of science in terms of the words that we use in the clinical side of things are not necessarily the same. That we might be using the same words on the clinical side of things and in the general public, but they're not going to necessarily mean the same thing, and clarifying that. Specifically with stuff like airborne versus droplet transmission, infection versus disease, that kind of stuff. And then a substantial chunk was on the statistics, and then just a few on the resources. So ultimately, lessons learned were to use what we have. They've already, GMR and the NNLM have provided a variety of resources to use. You can make it work for you. You can adapt it as needed while still meeting those requirements. The public librarians in general really like specific resource recommendations. So for patron-specific populations and for programming of, okay, what would I do with this information? And then a focus on science. They really like the science. And then just remember the audience. They're still librarians. So empowering them with the language and the scientific understanding to process the information they're retrieving, rather than trying to explain to them how to retrieve it, because they already know. All the skills that they already have will translate. It's just a matter of pointing them in the right direction and empowering them with what they need to understand what they find. Thank you. Anybody have questions?
Jess,
Yeah.
you said they provided the title and everything for you for your presentation. How much leeway do they give you for your presentation? Once they provide the topic and the title, can you pretty much do what you want? Or are there, besides the resources which you mentioned, how tightly are you tied to following a certain parameter of presentation?
Oh, I do pretty much whatever I want. When I say they provided the title, it's that was KPLA. So that was the Public Librarian Association organizers. I was in between two talks about computer viruses. So they picked one, I don't even remember what my original title was, but they had to pick one that was a little catchier and a little less virus specific, because they were worried it would sound too much like a technology talk and not a science talk. But in terms of leeway, yeah, I do whatever I want and then just report it. As long as I'm doing, they really like it to be public librarians, GMR does, like it to be public librarians or direct instruction to the public. I don't have a good venue for that, and I don't have the bandwidth to be creative. So I just do KPLA every year. And then in terms of tabling, we've never had an issue either. They They do have some suggestions and guidelines on populations that are underrepresented in biomedical research. You want to make sure that you're covering those underserved populations. They have some regionally underserved populations, specific counties in Kentucky they'd like to see more outreach to. And maybe specific campaigns. So like with the All of Us campaign, they like that to be promoted too. Did that answer that?
Yes, it did. Does anybody else have any questions for Jess? Well, if not, we are at time, so I am going to set up my presentation then.
I'll cut my share.
And we will go into the first session of lightning talks. Okay, so give me just 1 second. Okay, can everybody see my presentation screen for information seeking behaviors of hospital chaplains?
Yes.
Okay, awesome. All right, well, I am Rebecca Morgan, a clinical librarian at the Kornhauser Health Sciences Library, and I'm going to discuss with you information seeking behaviors of hospital chaplains and discuss some of my very preliminary research into this topic. In the past decade, healthcare chaplains have increasingly been embracing evidence-based practice, or EBP, in spiritual care. It means that they're more regularly participating in interdisciplinary research teams, primarily with nurses and allied health professionals. And they have become so embedded with evidence-based practice that the standards of practice for professional chaplains are now requiring that chaplains are staying informed of relevant developments in evidence-based practice, that they should be reading and reflecting on current research, and even it's encouraging them to collaborate or even provide leadership on research studies, which is a vast difference from, say, around 2008, when their role was only to be clergy and was not at all related to research. One might think that with this long, now almost 12-year move into evidence-based practice and research-based practice, that there would be some information written about the information-seeking behaviors or preferences of this population. It would be a false assumption, because there is essentially no literature written on the information-seeking behaviors or information literacy of healthcare chaplains. Only find one article in library scholarship that discussed the preferred resources of chaplains, and that was from a collections manager point of view. So suggesting titles that they might want to purchase. Nothing described any collaboration between libraries and pastoral care departments in terms of instruction or information literacy, which in many cases is one of our core roles. So very clearly, hospital chaplains are an underserved and underinvested in population on behalf of libraries and librarians. And so I created a multi-choice web survey that was administered to all hospital chaplains employed across 7 hospitals and 2 healthcare systems in Louisville. The survey focused on identifying the preferred information resources of this population. All potential participants had access to an on-site hospital library with at least one professional librarian, or they had access to an online library website that had similar resources and databases like CINAHL and PsycInfo. I also did receive IRB approval for this survey. So as you can see, I had a 73% response rate, which I was very happy with, or 30 out of 41 potential respondents did respond. And my survey asked participants to select their top 3 resources for seeking medical literature from a list of 11 possible options, which you can see listed on the left. I've highlighted in red in the chart on the right the resources that are most closely associated with libraries. As you can see, Google is pretty significantly the top preferred resource, followed by books, help from colleagues, journals, and professional organizational websites, rounding out the top 5. I want to highlight that library resources, or core library resources, including all of the research databases and Asking a Librarian, make up 4 out of the bottom 6. And all of the bottom 6 come in less than 23%, or 23% and lower rather. So looking at this, 47% of chaplains would consider a colleague a top choice for medical literature, while only 23% would consider a librarian or a library resource a top preferred resource for medical literature. So obviously there's a lot of work that needs to be done there. Also, a limitation that I realized in hindsight for my study is that I didn't indicate if journals or books were library-owned journals or books. Therefore, it's just as likely that they're personal subscriptions or personal collections of books, and they're not coming through the library at all, which again shows that library interaction is very much at the low end of our survey results. So what conclusions can we come to? Big one is that librarians and library resources are very underutilized by healthcare chaplains. And one way that we can help fix this is to ensure that hospital librarians are proactive in contacting their pastoral care departments and making sure that they're aware of the instructional services that we offer. Additionally, chaplains are not using research databases. This is potentially due to a lack of confidence or exposure to these resources. They might not even know they exist. And so hospital librarians should consider offering training courses or creating tutorial videos on how to use resources like PubMed and CINAHL and make sure that they are more familiar with them. And finally, further research is absolutely needed by librarians on this topic so we can better meet the information needs of this population. Thank you. And instead of asking any questions, we will go right into Mary Kay, if you're ready, Mary Kay. Mary Kay, are you ready to screen share and go?
Great. I was muted. Let's see. Yep. Slideshow. Okay. Oh. Well. So can you see my screen share or?
Yes, we can see it.
Yep, I can.
Okay, I can't. So my name's Mary Kay Marlatt, and I'm the Archivist Associate at Kornhauser Library at U of L. And back in April, Archives and Special Collections on U of L's Belknap campus began a collaboration with the Fraser History Museum to collect community stories about COVID-19. Our Associate Director for Clinical Services, Jessica Petrie, who works with the Infectious Diseases Division, and at that point had coronavirus on her mind 24/7, thought it would be valuable for Kornhauser to launch a similar project. But this one would be aimed at clinicians, researchers, healthcare workers, and patients. So in May, Kornhauser began collecting personal histories about the impact of COVID-19 on those populations. We decided to accept a diversity of items, pretty much based on the Fraser model, and that included written documents, photos, video, art, music, and anything else that expresses how those individuals are coping with and feeling during this particularly singular moment in our history. We posted this invitation on our webpage. We also posted on our Facebook page. and have distributed printed flyers around the Health Sciences Center and the University of Louisville Hospital. Riley Sumner, our hospital librarian, has coordinated with the Director of Communications for U of L Health to get the word out during their morning safety huddles and to the nurse manager teams at the hospital. On our submission form, we asked for the individual's affiliation or their position, which can include just general healthcare worker, researcher or investigator, public health personnel, epidemiology people, residents or fellows, a COVID-19 patient, patient's family or friend, or U of L faculty, staff, or student. Digital items can be submitted to us anytime through the website, and we plan to accept written journals and diaries or physical items after the pandemic has been resolved, if we ever get to that point. We decided to offer some prompts to help people get started with their audio or video or even their written submissions. These include things like describe a day on your unit in the last week, what kind of guidance did you receive or are you receiving from supervisors, hospital administrators? How has this crisis affected your coworkers? How does your family feel about you being on the front lines of this pandemic? And who's your most recent hero and why? We suggested that this could be a coworker, a family member, a friend, a patient, or anybody else that they thought deserved that title. Has the pandemic changed the way you feel about practicing medicine? That one's particularly for healthcare workers. And has the pandemic changed the way you view healthcare in America? We also recognize the varying levels of available technology and particularly proficiency with that technology among our target population. So we decided to offer two paths for people to create submissions, particularly of audio and video for the project. They can record themselves on a cell phone or computer and upload the file, or they can make an appointment to be interviewed by one of our librarians who will help them record their submission. To help people decide how to submit their stories if they are more technologically savvy, we have a selection of things they can use, different software that they can use to upload their narratives or pictures or whatever. Our web and technology librarian, David King, was instrumental in compiling this very inclusive list. Again, while trying to recognize that different people have different levels of technology available and also the ability to use it. Some of the things that we did specifically recommend included Audacity, which is free open source audio software, iOS voice memos on iPhones, which you can record from the built-in microphone, and the audio is really pretty good. We've also provided a listing of Android voice recorder apps that people can download, and they can share them that way. And we also mentioned LibreOffice that can be used to compose and edit documents, even those that were made in Microsoft Suite products like Word, Excel, and PowerPoint. We haven't had a lot of responses yet, but considering that we are still in the middle of the pandemic and it's not hit Kentucky terribly bad at this point. It's rising, as we all know, but we've been low in numbers and our hospitals haven't been terribly crunched. So this isn't very surprising that we haven't gotten a lot of stories, but we plan to leave this up until we, like I said, until the pandemic is over or at least contained and people aren't so worried about it. So that is where we are. I don't have any conclusions because we are still in the midst of this. Thank you very much.
Does anybody have any questions for Mary Kay or myself? If you want to, you can also put questions in the chat. If you don't want to turn on your audio and openly discuss, that is also. But if I'm not hearing anything.
I do. I have a
oh,
question.
All right, Jess.
It took me a minute. Mary Kay, are you doing anything personally? Are you writing or documenting on your own?
No, I hadn't really thought about it. It's not been a thing that's been terribly, I don't know, hasn't affected me that badly, I guess.
Yeah.
Been spread out to the public? Has it been through word of mouth? I know it's gone out in U of L today, our mailing, but are there other ways that it's been advertised so people are aware of the project?
We haven't come up with any ways to advance it. Of course, it's kind of hard to do that when you're stuck at home, but I think probably our outreach at the hospital has probably been our most effective, and we'll probably get more stories through that way than any of our other outreach vehicles.
I think there's been public Facebook posts.
Yes. We're low on followers though, so
Mhm.
But we'll see. I think as it gets, I think really as it gets worse here in Kentucky, that we'll probably end up seeing more stories and more people affected, unfortunately.
Does anybody have any other questions? Well, in of keeping us on schedule, which we are, I believe, currently on. Let us start the roundtable on the impact COVID has had on our libraries. And Mary Kay, that was actually like the most perfect introduction into this topic. So thank you very much for doing that. Basically, we just want to create a space for people to let us know how their lives have been impacted, how their libraries have been impacted through this fairly sudden closing, and in some cases, yet to be reopening that is going on. I know a bunch of you are students, so while you might not be affiliated with the library directly, I'm still interested in hearing how it may have affected your education. So to start with, who has actually, also feel free to put comments in the chat if you don't want to turn on your video or audio, that is perfectly fine. But who here has reopened? University of Louisville has reopened to a degree. If Jess or Tiffany want to discuss that at all. And then I believe UK has not opened yet. If Rick, Stephanie, or Lauren want to comment on that at all.
Sure, I can start. Kornhauser Health Sciences Library has opened officially, I believe, maybe like 2 weeks ago. I think this is our second week of actually being open, and just feel free to correct me if I say anything wrong. We're open on kind of a limited basis. We're doing smaller staff. We are really trying to balance out who's in the building and when. Of course, our PAS staff is more of our frontline folks who have to be out with the public. So we are really limiting how many of those folks are working every day. So we have a couple of shifts. We have 2 different people working for 4 hours at a time. And one of those persons sits at the front desk as you come in, which is guarded by plexiglass, and they're reminding people to show their badges and wear their masks as they come in the library. And then we have another person who assists at the circulation desk who will be able to check out items and assist patrons on the computers and things of that nature. As far as otherwise, the rest of our staff is kind of still doing a little bit of half remote and half in the building, staggering out their schedules. We have not seen a large number of folks coming back. I think when I was in the building last Thursday, I think there may have been maybe 10 people in the building at the most during that time.
Just visitors, or is that including staff and everybody?
Just visitors. As far as staff, we maybe had about 5 to 6 staff people in the building at that time, but just visitors, we had maybe about 10 folks in there. It's been a little slow, but we have made a lot of changes. We've moved furniture around to create adequate spacing. We've limited the number of folks in our study rooms, changed the capacity there, put up plexiglass barriers and open computer area spaces. So done a lot to try to make folks feel comfortable as they're coming back in. And of course, being on a health sciences campus and serving folks who are on a more year-round schedule, our students are starting to come back now, as opposed to on the main campus where students don't really come back till late August at this point.
Mm-hmm.
And I can speak next. This is Rick from UK.
Hi, Rick.
So we, as you know, we have not opened yet. Our dean is targeting the date of August 3rd. That's when our first and second year medical, first, second, third year, I think it is, dental students return. So I went in today with Laura and some other people, and we started moving around chairs, kind of prepping for the anticipation of this date to happen. He's pretty firm on having Young Library open in some capacity, as well as the Med Center Library. I'm proposing that we do limited hours, 8 to 5, Monday through Friday. I haven't gotten approval on that yet, so I'm still waiting to see what that will be. I'm kind of torn on the after hours access. We do have swipe card access, and I've been watching the OSL list, and some libraries allow it, some libraries don't. So I'm not sure where we'll fall on that one. But we're doing the similar things. It's going to be reduced seating. I was just amazed when we moved the chairs out of our back area, the third room that we have for private study. And we have study rooms that we can't lock, unfortunately. So we, lift them with just one chair. But I'm concerned about people moving chairs around, as I know I'm sure all of you are, and how to really police that, because we can't get into that habit of trying to police that. If they don't wear masks, if they don't accommodate when we ask them to do something, I'm told they can be asked to leave. So it's a whole new experience. I'm opening just hopefully the ground basement floor, our newest renovated space. That's our biggest footprint. And then we will have to think about our first floor opening as well, kind of like a phase 2 a little later in the semester, because the expectation is that we will open that. So a lot of unknowns still at the moment. We're making our plans, editing our plans. The dean has to send them up the chain to get approval from the university. So I don't know how long that'll take, but August 3rd is not far away. And we expect to have limited staff working as well to cover that service desk. The reference people will still be doing remotely. We'll do virtual reference, virtual instruction. I'm anticipating walk-in people that come in. We can hand them an address to go to a virtual kind of Zoom room, and I'll try to have a schedule of people on watching that. So it's a whole new way of thinking about your services, and I'm sure there's a lot of stuff I haven't even thought of at this point that I'm going to learn about. So not a fun time.
And then I see in the chat that Amy has said that Sullivan is open 2 days a week.
Yeah,
and that's interesting. I ever conceived or thought of going on a partial schedule like that. Instead of being 24 hours, we are, on a more limited schedule than we had been, but that's an interesting way around it. I mean, I wonder, I don't know if you know the answer to this, Amy, but if that was decided based on the busiest class days, or if there was a specific metric that that prompted you to decide that.
Sure, we asked department directors what would work for them. Right now, only students are on campus for labs, the in-person, like the baking labs and the surge tech labs. So those are really the only students we're seeing. And the program directors for those said that these are the hours that would work best for them. So that's what we're trying right now. It just started this quarter. So we've only been doing this for a couple weeks. I haven't seen many people. I'm at the College of Nursing and College of Allied Health, so I'm over at the DuPont campus. I know Jody's here, and she works at Maine. And I haven't seen many students, just people popping in to print stuff out, not any reference questions. But I'll add that similar to Rick, we're trying something new. We're trying in Blackboard this Collaborate live help sessions where we advertise a link and students can join us online. And I've used that quite a few times. It's been successful. I've had just one student who had computer issues, but other than that, students seem to like it. I can share my screen and show them how to do a search, and they can share their screen with me pretty easily and show me kind of what they're talking about, if that helps in the session. So that's been really successful. And then our Ask a Librarian service has really been useful. And students are just sending us questions all the time. And before this pandemic, I'm not sure if they used it very much at all. And Jody, you're on here, so if you want to jump in and say anything else about Sullivan. I think that's Jody from my campus. There's no last name. It might be a different person, sorry. Oh,
Nope.
she says I got it all. Okay, awesome. Thanks.
Or at least in my personal experience with doing clinical reference still, even though we are doing on-call hours where the students or any of our patrons have the ability to contact us via Teams during our on-call hours, I found that I've almost been busier. It seems like once the physical boundary was taken away, I've had more people feel like they could contact me just via email or set up a web chat or a web conference than before. I mean, I definitely feel like I'm doing more teaching than I've ever done before on a one-on-one basis. So that's kind of an interesting outcome that I didn't necessarily expect from this whole thing, but it's been good. I've definitely made more contacts with some of my departments than I ever have before.
That's great.
As somebody who doesn't do much reference anymore, I can say that I have also just been very busy. It just seems like we're working much more than we were before. I'm not sure if that's because we're all at home, and I don't know about you all, but I seem to have a lack of boundaries now that I'm home. I work past my schedule most days and, working into the night or whatever. But it just seems like we have more to do during this time.
I can say the same. I do the same thing. It's hard. You kind of lose track of where you are, and I do the same thing. I work longer, come back at night at the computer to answer questions. The librarians stay very busy. They get instruction requests, systematic review work they're doing. I mean, we have to submit weekly summaries of what we're doing while we've been off campus, and I've been amazed at the amount of work everyone is putting out there. So they're working very hard and being very productive, even in this difficult time.
Mm-hmm. I'm watching the chat. Amy says, yes, I work all the time now.
Yeah, no boundaries either here. I'm answering emails at 6 at night. I used to have really good boundaries, but not anymore, not during this thing.
No, because you're working on something, you keep working on it, and then you realize it's 9 p.m. You're like, oh,
Exactly.
Okay, well, it's done.
Mm-hmm.
But
happened to me too. Just end up working.
I found that most of my patrons have been pretty respectful of not emailing me after 6 with stuff, unless if it's absolutely critically important. If I respond to them, I will definitely get a response back at 9, 10, 11, midnight. But I'd previously, prior to this, interestingly enough, had issues with nursing students texting me at like 1 in the morning, 2 in the morning. And that hasn't happened at all during the pandemic. So I don't know. I thought that was kind of interesting too.
Can I jump in? I wanted to ask, I think we only have one hospital librarian here. I think that's Riley. I was looking to see if Cece or Beth were here. But just curious, like, that's kind of a space that never closes. How have you all been handling COVID?
Yeah, I was about to actually just pop in and share. So just this week, actually, we came back into work. So Ainsley is the other person who helps us out. So she's been sitting Mondays and Wednesdays from 8 to 2, and I'm doing Tuesdays and Fridays from 8 to 2. But so that's a new thing that we just started doing. But to shut down the hospital library was, or at least not us go in, it was definitely interesting because we are there to help people in person. So to get out the word that, hey, we're going completely virtual was difficult, but honestly, a lot of the people that I work with went digital anyways. So like all of my clinical meetings are still meeting online. All of my nursing congress meetings are meeting online, and everyone was pretty good with just allowing us to transition to remote and felt comfortable using the different platforms to meet. And I still stayed very busy. Yeah, nothing has really changed on the busy front, but that's kind of what it's been like.
So, Becky, I know, do you want to ask the next question?
Yeah, Tiffany came up with some great questions for us to discuss with this, and this is actually the one that I found the most interesting, and it might actually be the last one that we have time to really discuss in any depth. But did COVID expose any weaknesses in your library discussion or your library structure? Sorry, I can't read or talk right now. Any access issues, lack of online support, lack of tutorials, preparation to switching, working remotely? What were there any surprises that really caught you off guard when you had to switch to a mostly, if not fully, remote services platform?
I'll jump in and say yes to that immediately. So my role as collection and development librarian is, of course, maintaining our access to our resources. And we've recently acquired a few things. We got Browsing last year. We got Discovery Health Services last year. But our main campus is still using WMS, and we still use WMS as a ways to check out our items. So we kind of have a dual catalog system going on. So for me, I think this has exposed a lot of linking issues that I didn't know existed before. It's actually been a good thing, though, because we haven't really been able to fully find all the cracks in our access, but this has really helped expose some of those things. It's also shown me that Connect from Home access is very flaky. I don't like it at all. We had experiences where, somebody would tell me something's not working. I go try it, it's working fine for me. We're doing literally the same thing. That's a lot of times how we find our issues, right? We see if we can duplicate the error from wherever we are. And a lot of times we would both be connected from home, off campus, and I'm getting in fine and somebody else is not. So for me, it just exposed a lot of issues with Connect from Home access, a lot of issues with linking access between vendors and our cataloging system. So I think it's been helpful in some ways. I'm not sure what I can do about the VPN and the remote from home thing, but definitely been able to improve some of our access issues as far as like within our catalog and within Browsing.
And then in the chat, Laura said that internet access for some staff has been an issue, and I'm sure that has been an issue everywhere. I don't actually manage staff or deal with them, so I can't speak to any specific instances with us, but I'm sure there have been issues. And I know that on our main campus, there were major issues with a lot of students not being able to have adequate internet access or access to computers to do their work, even if we haven't had as much of a problem with that on the health sciences campus. And then Stephanie also said that one user access at a time ebooks have been an issue. Has that been an issue with us, Tiffany?
Yes.
As our collections manager?
Yeah, I've had a lot of I'm trying to get this book and I can't get in it, questions where we've had to look at those. And unfortunately, we've kind of changed our buying model over the years to try to get books that have more than one person accessing at a time. But some of these books we've had for a while, and the platforms they're on are just one person at a time access. So it's kind of been a case of sorry about your luck on some of these books, but yeah.
Do you have anything you would like to add, Rick? Besides what Stephanie said?
I'm sorry, could you repeat it? I didn't hear you.
Sorry?
I didn't hear what you said, Rebecca.
Oh, I just said, do you have anything that you want to add to?
No, I mean, I agree with what they said. I think, when we had to pivot immediately without any time to get ready for this, it was incredible. We went in on like a Monday, and then that Wednesday, boom, we were off site having to do remote work. So there was very little time to prepare. I mean, we were trying to get people machines set up, laptops taken home. It took so much effort. And the first week, people trying to adjust to that situation, environment, but everyone's done really well with it. In the library system, we have had a limited number of staff that did not have internet access, so it took a good couple months for the university to provide some Wi-Fi spots for them. So we worked through those issues, and yeah, it was a challenging time. One thing that was nice is the vendors opened up a lot of access for us, things that we didn't have access to, and I got a lot of comments from users about that was really great that they got a chance to kind of like trial things out. Not that we can afford to buy them now when it's over, but it was a good opportunity to at least be able to have access to that, because that helped us a lot during the summer too. So yeah, much of what everybody else has said, we've experienced that too.
And what has everybody been using to communicate on across your organizations? Like I know for Kornhauser and for U of L, we're using Teams, which was a bit of a learning curve for some to get used to.
You know, we have Teams at UK, and they are moving toward that. I think it's going to replace Skype, chat, or whatever in the next year. So we do have that place now. We at the Med Center Library, and I don't know that many in the library system have been using it. I have not. I've been learning Zoom. I've gotten really good at Zoom. Before this happened, I could just go in and attend a meeting, but now I can share screens, have my own Zoom room, and so on. So I feel like I've accomplished a lot in that regard, but we use Zoom still predominantly.
I think it was Jess, but it may have been Ansley who discovered the EndNote does not display properly on any web conferencing software but BlueJeans. If you
It'll do Zoom.
And Zoom?
And I think Collaborate Ultra has fixed it too. But Collaborate Ultra and EndNote just takes so much processing power that it would do a weird flashy thing. Teams takes exponentially more processing power than that. So it would flash for a while and then crash completely. So the only thing we could run it on for a while was BlueJeans. Zoom theoretically works. That's what EndNote offers their EndNote classes on. We just didn't have it at that point.
I was going to say, we get a lot of EndNote requests, and Breck has done a lot of that, as well as Lauren and Stephanie, but I've not heard of any problems, but we have been using Zoom to do those kinds of share screens and instructional sessions. So I think it's worked pretty well for us. I've not heard of any major complaints about it, but that's good to know. I didn't realize that about Teams.
Yeah, I have not had any problems using Zoom to show EndNote, and I've been doing that a lot the last few weeks.
Yeah, in Teams it flashes like it is.
It's a disaster.
Pleasant. But it doesn't for the people watching it, right? It's just for the presenter.
Right, it's just the host.
But it's almost impossible to do anything with it when you can't barely look at your screen. So
these are good things to know since we haven't moved to it yet. Things to watch out for.
Well, we're actually at time, so even though we didn't have all the discussion we wanted to, I still feel like I learned a lot from what other people are doing. That was really interesting. Let's all take a 10-minute break. I'm just going to leave it as it is, but stop the recording. Let's all try and be back here at 3:20. And our first presenter, I need to schedule again for the, we'll start our next round of lightning talks, which will be, sorry, my computer's being very slow. It'll start with Beck and Kayla, and then be followed up by, I believe, Emily and Stephanie. All right, so see you guys in about 8 minutes now. And I'm pausing the recording now. Everybody, just to let you know, I have started the recording again. And Breck, you can start whenever you're ready.
Okay, so I'll go ahead and start. My name is Breck Turner. I'm presenting along with Kayla Robinson. Our presentation is on flipped classroom for library instruction in the College of Pharmacy. This project started when Stephanie Henderson, the pharmacy liaison librarian at UK, received a request for an evidence-based medicine instructional session for a pharmacy course. We met with her and decided to make it a flipped classroom session. That meant we'd make tutorial videos for specific databases, accompanied by a pretest. These were meant to be watched and completed before the in-person library instruction. To make these tutorial videos, we use the screen recorder and video editor Camtasia. We've been doing this on a UK laptop that we had it installed on. Camtasia made the video making process really easy. It let us record video of what's taking place on screen and of the users. Thankfully, editing clips together was simple since I had to stop recording several times. And Camtasia let us trim those clips and combine those segments together. Camtasia was the best option for us at the time since the Medical Center Library had a license for it. But you can use any video recording and editing software that has similar features to this to make these kinds of tutorial videos. After the video editing was completed, we initially emailed the videos to Stephanie as MP4 files, so she could get them included in the Canvas module for the course. And recently, we've put these videos on a YouTube playlist, so they can be featured on the new pharmacy research guide that we've been working on. This will provide for much easier accessibility to them in the future. And now, Kayla will talk about the process of filming the videos.
Okay, so overall, we researched, filmed, scripted, and edited 5 separate videos on 5 different databases, those being Legacy PubMed, not New PubMed, Cochrane Library, ECRI Trust, Clinical Trials, and Scopus. Our videos were centered around 5 research scenario questions provided to us by Stephanie that we had to research and create search strings for in order to structure the video around it and to provide an accurate tutorial of the database for the students who are going to be watching. We also added those 5 scenario questions to a PowerPoint that we projected during our tutorial so that students who are hard of hearing or students who are visual learners could read the question and follow along with us. We also wrote a script for 3 reasons. The first being that it helped guide our videos. If we got lost, we could look back and see where we were and see where we were going. It also provided something for Stephanie to approve of before we actually started filming, so she knew where our videos were going and where they would end. And finally, and most importantly, for accessibility purposes, we wanted a transcript that we could upload simultaneously with the videos for students who are hard of hearing or for students who are visual learners and wanted to go back and look at the videos again, but not necessarily watch them. So that was the importance of the script. But after we researched and scripted, we filmed and edited, and everything went really well. And in time for the in-person class, which Breck will talk about alongside our pretest that we constructed.
Right, so like Kayla just mentioned, we created a pretest to accompany the tutorial videos. The students had to complete it before the in-person class. The questions were focused on making sure the students actually watched the videos. So we mostly avoided multiple choice questions in favor of having the students write in their own answers. The correct answers to these questions were directly mentioned or shown on screen in the tutorial videos. The videos, script, and pretest were all submitted about 12 days before the in-class library instruction. So the students would have had about a week and a half to watch them all before the pretest was due and we had the in-person class. Watching the videos and completing the pretest ensured that the students were at least introduced to how these 5 databases worked. This let us cover new material during the in-person class rather than demonstrate how 5 different databases work. It gave Stephanie time to teach searching using the PICO model and for me to introduce the new PubMed. And now Kayla will finish off by talking about what we've accomplished since finishing this project.
All right, so we finished this project in January, and since then we filmed 3 videos for the College of Pharmacy orientation, 1 for the Pharmacy LibGuide and Intro to the Medical Center Library, and we're currently working on 2 longer, more comprehensive EndNote tutorials that we're going to use to teach basic EndNote. COVID has, of course, changed the way we've done everything, but it's particularly changed the way we've done these videos. Previously, we did them together in the same space, using the same software, but since obviously we can't be together in our space anymore, I've had to resort to Mac software. So I've been using QuickTime Player, iMovie, and Voice Memos, which is a little bit of a Mod Podge, but it's worked and our videos have gone up very smoothly, easy to edit, which is the important part. And then our collaboration has also changed because we can't be in the same space. We're sending each other our different pieces and then editing them and then meeting over Zoom to get that completed. So thank you for listening to our presentation. That was Flipped Classroom for Library Instruction for the College of Pharmacy.
Great. Thank you so much, Kayla and Breck. If we could just jump right to our next presentation, because we were going to have questions at the end of the lightning talks. That would be Emily, who is coming up next.
Sure. Okay, let me share my screen too. Okay. So hi, I'm Emily Leibcap, and I'm going to be discussing my practicum experience at the UK Medical Center Library. I started my MSLS program here at UK in spring of 2019, and then I will graduate in spring 2021. So my career goals are something in academic libraries or special libraries or medical libraries, and I'm interested in these because I like the idea of libraries have a very specific scope, and I also I like that librarians are part of the research process in all of those spaces. And so I've tried to get as much practical experience as possible through internships and trying to meet with librarians because our program is online. And so this practicum came about when I wanted to attend the KMLA student event in August. It was like a pizza party, I think, but I couldn't go. But Lauren agreed to meet with me, Lauren Robinson. And so we went to Starbucks, and she actually offered to set up the practicum. And so I was very wowed by that. And so we agreed to set it up and start in the spring. So I started in January. Oh yeah, that was supposed to be my slide. So we agreed to 3 main parts of the practicum. So the first was me working on a LibGuide about substance abuse. And so this was helpful because that way I could practice coding and then also curating resources. And then also LibGuides are used at a lot of different libraries all over. So it would be good to get familiar with that. And then the next part of it was observing Lauren. And so this was definitely the most generous part of her supervisor role. So I would look over her shoulder while she made search strings, or she would tell me about different users she was working with and how she communicates with them, or how she works on systematic reviews or literature reviews. So I was able to gain exposure to the real life responsibilities of a real medical librarian. And then finally, we had training sessions and workshops that Lauren and Stephanie put on for us. And so we learned how to use specific resources like CINAHL and PsycInfo and other databases. And then we also learned more about medical librarianship as a career. So we talked about research data management and scholarly communications and things like that. So this is just what my LibGuide ended up looking like. And so what did I learn and why was it useful to me? So the biggest value of the practicum was that I gained valuable experience in things that I would not have necessarily learned in my formal coursework. So for example, I did take a class about health sciences librarianship, and it was a great overview to the profession, but it just had some more theoretical knowledge that ends up not being super applicable. So for example, we were taught to only ever use mesh terms when searching in databases, which is impractical for a lot of reasons. And we read Greenhall's How to Read a Paper on Evidence-Based Medicine, but we didn't really go into the specifics of how that's applied or what that is relevant to the actual day-to-day of being a librarian. And then in my information technology class, I learned very basic HTML, but we didn't cover mobile formatting or things like that. So that was something that I learned that was helpful. And then, so the idea of hidden curriculum is also something that was relevant to my experience. So hidden curriculum is, I think, more of a sociological term, but basically what I'm using it to describe is the gap between what's taught in coursework and then what you learn on the job. And so that's something that I really gained with this as well. And then finally, understanding the medical library user population, because it's very diverse, and I would not have learned that without getting exposure to that and having Lauren tell me about all the different types of people that she works with. So my takeaways for students are definitely to do a practicum if you can. And then my takeaways for medical librarians are that I know that you guys are all very busy and have lots to do and have to wear a lot of hats, but if you have room in your schedule or room in your heart to do a practicum and to supervise a practicum, it would really make a difference in a library student's life. in career path, and you might get a LibGuide out of it. So I know that the pandemic has also made things difficult, but I think it would be easy to transition to online just because when we had to go online in March, everything stayed pretty much the same. So that is my presentation.
Thank you so much, Emily. And again, we are going to just keep moving and have questions at the end. So Stephanie, whenever you are ready, please feel free to share your screen.
Okay, can you all see my screen? No, you can't.
Yep, for now it's coming.
Now. Perfect. So this is my poster presentation. And my name is Stephanie Henderson, and I am the Nursing Liaison Librarian at the University of Kentucky. This presentation, or the course that I designed and developed, was in response to a grant that was funded by the National Network of Libraries of Medicine. So my former colleague and a mentor who works at Northern Kentucky University invited me to design a curriculum for the library informatics program at NKU to help with this grant. So the grant was titled Health Matters, Educating Library Staff to Respond to the Health Literacy Needs in Their Communities. So the grant paid for the tuition, fees, and books to eligible students who were employed in public libraries located in a Kentucky medically underserved community. So the library staff who received this grant, they needed to build their knowledge of health literacy and consumer health resources to address the needs of their community. The health literacy curriculum was designed for a 7-week online course open to all students enrolled in the undergraduate library informatics program at Northern Kentucky University. The course was designed to introduce students to health resources and programming in libraries. Most of the programming was in public libraries, although we did, in the curriculum, we touched on academic libraries, hospital libraries, and special libraries as well. The curriculum presented free core consumer health information sources from the National Library of Medicine. I used the book Promoting Individual and Community Health at the Library by Mary Grace Flaherty to serve as the textbook for the course. The 7-week modules were broken into the topics listed onto the poster. You can see the course objectives are listed here as well. The course started by introducing health literacy and its impact on patients and their families. We discussed tools to help consumers know more about health literacy and ways that they can become more health literate. Consumer health was discussed, as well as the resources for consumer health and the consumer health needs and behaviors of library patrons. We touched on privacy and ethical considerations in these conversations as well. The final project for the class was to develop a health library programming, either an activity or activities in a series for their community. They completed assignments ranging from a community assessment, consumer health resource evaluation, and their final project was, again, that fundable grant application. The course was designed with a variety of learning modes and activities. And what really made the class interesting were the discussion boards, because the class started about the 3rd week in March. So the 3rd week in March is when, COVID happened and all the businesses were closing and the schools were moving to online. So there was a real sense of, wow, this is, incredibly applicable to my learning, and a real sense of, how does library staff and then the future staff, how do they help their communities with these health related questions and health literacy. So it's a very timely and needed curriculum for the program. If y'all have any questions, I'd be happy to answer them.
Yeah, if we have any questions for all of our presenters, that would be great. Also, thank you for your wonderful presentations. I actually have a question for our students who have presented. What interested you guys in health sciences librarianship? Of all the types of librarianship, what prompted you to take a course in it, or get a graduate position in health sciences librarianship? Just what was the appeal?
I can go, I guess. I kind of fell into it, interestingly enough. I took a gap year between undergrad and my master's, of course, and I did a research internship volunteer with a UC medical librarian. She was the nursing liaison, like Stephanie, and I really enjoyed it. I thought the populations were super interesting to work with. I was always interested in medicine and health, so I just kind of fell into it, and then I was offered a GA position here at the MCL, so this is working. And I've really liked it so far.
Yeah, and then I kind of talked about this a little bit in my presentation, but I'm interested in academic libraries and special libraries. And I really want to be like part of the scholarly research process. So that's what I like about it a lot. And then also after I graduated from undergrad, I worked at a healthcare finance consulting firm, and I got like weirdly very into ICD-10 coding and like all of the possibilities for data and learning about the medical field. So I just really like that. And so I wanted to kind of apply that going forward, even though that doesn't really have anything to do with medical librarianship, but yeah.
Thank you, guys. Does anybody have any additional questions? Well, I guess not, but thank you guys. Those were fantastic presentations, and I enjoyed all of them very much. Riley, are you ready to give our final presentation for the conference? You are still muted. I'm gonna unmute you.
Muted. Yeah, I love Zoom. All right. We'll go ahead and pop in. All right, so my name is Riley Sumner, and I am the hospital library manager at ULH. And I received my Master's of Library Science at the University of Kentucky, and I've been working at Roundtree for the past 1.5 years now. So today what I'm going to do is I'm going to share our partnership that I created with the Louisville Free Public Library. Before we start, I do want to just throw in a quick caveat real fast. With COVID, I haven't been able to do the statistics and everything to see how this program is going to turn out. It was expected to begin in spring of 2020, and then a pandemic hit, which we've talked a lot about today. But more or less what this is going to do is cover how the partnership began, why I chose the Louisville Free Public Library, and then ways I'm planning to promote it as we move further along. So let's go ahead and get started. Before we hop in, I want to give you a brief overview of what Roundtree Hospital Library looks like, as well as some of the services we provide for our family members and patients. So we are located in the University of Louisville Hospital. We have 8 computers, 2 printers, and 3 large tables with chairs. So this is kind of an overview of what our little hospital library looks like. We also have a small medical text collection that's currently in the process of being weeded out to get rid of some of our older texts from like 1995, not as relevant anymore, but we're moving along with that. And then we also have our community book collection, which is listed right here. So our community book collection comes from donors primarily. So I brought in books. We have our nurses bring in some books and stuff, but really we rely solely on donations for those. So anyone can check those out and they don't have to return them. So that's kind of one of the resources we have that we offer to patients and family members. Some more resources that we offer. We do have the community book collection, like I just mentioned. We have coloring book sheets for people to come and pick up. We also have online access to consumer and patient health resources in our Roundtree Library LibGuide. And we also offer in-person or virtual support. The other thing is we are open for the for anyone in the or anyone in the hospital to come in between Monday and Friday from 8 to 4. Those are hours that were set before COVID. It's a little bit different right now, but that's generally all of the resources that we provide to our patient and family members. And I do think that what we do provide is excellent, but I did want to go a little bit further and really find a way to connect with them and give them resources that would kind of help their stay a little bit more. A few years back, my husband was in the hospital for a long bit. And I remember when he was doing tests or even, you know, just sleeping, I wanted something to do that would kind of take me away from our troubles that were going on. And one of those ways was through reading. So I thought, how cool would it be if maybe we were able to create online resources or ebooks or audiobooks that we could provide to our patient and family members in the hospital. But the thing was, I had to find a cost-efficient way to do that. It's not like I could go out and get a whole new collection of fiction and nonfiction books. It needed to be a cost-effective way, which came the idea of partnering with the public library. So the reason I chose Louisville Free Public Library, which I will now shorten to LFPL because it's a lot easier to say, is because it has 17 branches in the Louisville area. It's the largest public library system in Kentucky, and it serves over 2 million visitors annually. So it has a broad range and it's well known within the Louisville community. The other reason why it was enticing to reach out to the LFPL is because it did receive the NNLM All of Us Ambassador Program award recipient, which allows them to have over $100,000 in grant money to help with consumer health resources. So I thought it was a natural partnership. Maybe we could work on different things, bringing in more of the All of Us stuff for our consumer health information. So in my mind, it was a natural partnership, but I just didn't know how we were gonna get there. So another reason I chose LFPL is because they have these amazing online resources. So you see they have a public library group, which you can look at classical and world music library and the jazz music library. They also have ebooks that they use the source called Libby. We also have Canopy, which is a video streaming service that people are able to use. Audiobooks are available through RB Digital and Libby. People can also take online courses through lynda.com and Treehouse. And then they also have access to e-magazines and comics. And anyone who has a LFPL library card has access to all of these online resources. So in my mind, I thought it would be a great way of maybe becoming a mini branch of the hospital so I could have people sign up for an LFPL card and then have access to all of these online resources without having to leave their hospital room. And they could access them on their computer, on their phone, or on their tablet. So that was kind of the thinking of it all and why I decided to choose LFPL to partner with. Next, we're gonna talk a little bit about building the partnership. So not only is LFPL the largest in the state, it also provides, you know, all of these wealth of resources. So when I approached the main library manager, Nicole, I wanted to discuss that possible partnership, you know, making the pitch of it would branch you all out, it would give you great notoriety, or, you know, people would know more about you guys, get your name out there, not that they needed it, but any bit of free advertising helps. And by building this partnership, LFPL would, like I said, become more integrated into different communities that they might not be able to reach, because ULH does serve a very diverse community. So with all of that in mind, with that pitch of, reaching out to more people, Nicole thought it was a great idea, and we were able to kind of get started. So since LFPL did receive that NNLM grant from the All of Us campaign, we also discussed on how we would become another spot for them to share those consumer health resources. So it all just kind of fell into place, which was great. But it was that open communication of talking to them and sharing my ideas and pitching it to something that would be great for them as well, and also for the library. So what do the logistics look like? How are we going to put this in place? So during the meeting, we discussed how we would go about this. I knew that I wanted to give them an actual library card because it would entice them to go to their own branch when they got home, and they would also be able to have something tangible to remind them to use it while they're staying in the hospital. So we did decide that Roundtree Library would be a mini branch. We would get our own stack of library cards, and then we could help individuals sign up for a library account through either our computers in the library, or show them how to do it on their phone, tablet, or computer in their hospital room. So normally when applying for a library card off-site, so if you're not applying for it at a branch, it's normally a paper form that you would have to send in, and then it takes about a week for it to process before you have any access to their online resources. So I knew that was going to be kind of a problem. So Nicole and I worked with the LFPL IT team to develop an online form that people could fill out. This is a basic idea of what the form is going to look like. It might have a little bit more information, like saying that they were registered at ULH. But other than that, this is what the basic form is going to look like. And this form will be sent to the main branch for their circulation department, and they will approve it. Nicole and the IT team thinks it should take it's a 24-hour turnaround, but if we were to submit it during normal business hours of the library, it should be only about an hour or so turnaround for it to get approved. And then they would be able to get notified through their email that their account was ready for use. Let's see, what else? I'm trying to make sure I get everything with the logistics. All right, I think that's everything on that page. So the final thing that I want to discuss is the promotion strategy that we have set in place, because that's kind of a big deal. We have to figure out how we're going to share this with the hospital, with the community, and what avenues we're going to take. So one of our biggest advocates at the hospital is our patient experience team. And they're a great group of ladies who go around and they introduce themselves to every patient on the unit and their family members, and share with them what kind of resources the hospital provides for them, how they can improve their stay, just overall how to make their stay better. So currently right now they have a little flyer for the library, just showing some of the resources that they have, that they can come down, use the computers, we have chargers and things like that for them. But the folder will now include this new program. So it'll share how to sign up for our card. They can come down to the library to do it. And we'll also train the patient experience team how to get it all set up with the patient in the unit. And then they were also interested in having us come and round with them on the units, which would be really fun and a good way to promote it. So the other thing that we're going to do is we're going to put up some signage in Roundtree Library, add some bookmarks, and then the computer icon on Roundtree computers. So the signage will essentially go up with the same flyer that we're putting in the patient experience folders. This will go up on our bulletin boards, and we will also put those up next to our community book collection. For the bookmarks, what I want to do is I want to make some bookmarks with just a basic overview of what the LFPL program looks like and how they can sign up. And I want to put a bookmark in each one of our community books so that as they're being taken out, they have a physical thing to show them how to sign up for an LFPL card through the hospital. The final thing we'll do with Roundtree is we will put a little form icon for them to sign up on the Roundtree computers to make it really easy for them to fill out, and they won't have to find it going through our Roundtree website. So the next part would be how we're going to promote it through our nurses and through our faculty and for our staff at the hospital. So we will put up the same signage on the nursing unit bulletin boards while also reaching out to the unit nursing managers to make sure that they're aware of the program and to help spread it up a little bit more. The hospital also hosts bi-weekly nursing orientations for all of their new nurses that come in. So I'll be adding in a slide about the program and how they can sign up and how they can share it with their patients and family members. If they want more information on it, they can always reach out to me. And then we also have our University of Louisville Hospital listserv that will be sent out. And then I will also be doing a monthly blurb on what's new with those online resources, if they're promoting something or if it's a special month that one of the services is promoting. And the final thing that I want to do is tabling. So with tabling, we do have an area at the University of Louisville Hospital right outside the cafeteria where we can rent to set up a station to talk to people and get them all signed up. So with LFPL, I'll be working with them to bring in a person once or twice a month to come in and actually do the actually sign people up there so that they get instant access rather than waiting 24 hours. But that'll be like a special occasion day. We'll put that out in ULH listserv and be a way to really interact with everyone in the hospital. Now, finally, what does it look like when we're moving forward? So as I mentioned at the beginning, this partnership was set to begin in the spring of 2020. And LFPL is currently not, they're all working remotely, as am I, and kind of in the hospital. But since they've been delayed, we haven't been able to get this project going. So we haven't been able to capture any statistics of how many people were signing up or how the database usage has increased. But LFPL is still eager to continue this partnership. It's just a matter of when we're going to start it again. So we are in discussion of when we're hoping to start it again, maybe by the end of the year, beginning of next. It just kind of depends on what this COVID pandemic does these next few weeks. But we are planning on covering or gathering statistics on, like I said, how many people we sign up in a month. And then we're also looking at the usage of the online resources in their access and comparing it to years past. So that is pretty much everything. Yeah, that's the end of it. So if you have any questions, just shoot them in the chat or start talking to me.
I have a quick question, Riley.
Yeah.
First of all, this is an awesome idea. I love it so much.
Thank you.
Congratulations on this program. I'm wondering if you did already covered it. I'm sorry, but could you talk a little bit about how it fits into the NNLM grant?
Yeah. So one of the ways that we're going to do it is really we're just going to be, like I said, a mini branch. So any of those resources that NNLM gives from the All of Us campaign will be taken over to the library. So we'll have a little stand in there promoting the All of Us campaign. And I'll also be working with their new librarian that LFPL just hired to work on some programming. So the hospital does have space for us to host programs. So we've been kind of a conduit through her to help either connect with different specialists or develop programming.
Perfect. Thank you.
Yeah.
I have a question, but I do want to say that, yeah, this was a really creative wonderful idea. When I was at Roundtree, I mean, we always talked about ways to get ebooks or music into Roundtree for the patients. I never would have considered linking up with the public library. So that is really brilliant. So on that.
I was going to ask about, since LFPL is letting people sign up for their own library cards virtually right now, have you considered promoting that for them in the
Yes.
meantime?
Yes, it has been promoted and shared. I haven't heard anything back about what that's looking like for them, but I have been sharing their online one. In fact, I just signed my husband up yesterday.
Yep.
So.
Data point of 1, I signed myself up.
Perfect. So now I have 2 people signed up. It's all coming together. I'll put it in the stats for my next paper.
Does anybody else have any questions for Riley? Well, if not, I just want to take this time to thank everybody for coming and for presenting. These were all fantastic presentations that exceeded my personal expectations, and my expectations had been high. So really, kudos to everybody. I really feel like I learned a lot and got some new perspectives from either different libraries or different positions that I would not have otherwise received. So thank you all for that. Do you have anything to add?
No, just the second is thank you again. The presentations were all really great. Just appreciate you all's effort in helping to support KMLA. I hope you all enjoyed the conference. It's our hope to do this again, either when COVID is still going on or thereafter.
And we, Tiffany, I can't even remember if I talked about this with you, but I did talk about this with Lauren. And we will be sending out a very brief survey to attendees just to get a rough approximation of what you thought went right, what you thought could be improved, and to get a little feedback on this. So if we continue to have conferences, we can make sure that they're the highest quality possible. So keep an eye out for that. That's probably not going to be for a couple days, but we would love all of you to respond if you can. And other than that, thank you all for making this conference a success.
Yes.
Again, it was a wonderful time, and we hope to see you guys soon.
Thank you all.